According to recent data, almost 70% of Medicare beneficiaries did not review or compare plans during Medicare's open enrollment period. The primary reason is that many find it challenging to navigate and understand all the available options, so they simply let their plans automatically renew. Needless to say, this is not the best approach, as it typically leads to overpaying for coverage, gaps in care, and missed savings. In this video, I'll walk you through the key details of Medicare and what you need to know for the open enrollment period that began last week. With some big changes coming in 2025, it's crucial to make informed decisions now to avoid costly mistakes later. Let's dive in. Whether you want it or not, when you turn 65, Medicare becomes a part of your life. It becomes your primary insurance, and most health plans pay secondary. This means if you are covered by an individual health plan, a small employer group plan, or a retiree plan, you must enroll in Medicare at 65. If you don't, your claims may not get paid, and you could face late enrollment penalties. The only exception is if you or your spouse are still working and have coverage through an employer with 20 or more employees. In that case, you can delay enrolling in Medicare without penalties. So as you approach your 65th birthday, find out if you can keep your current health plan after you turn 65, and it won't trigger late enrollment penalties down the road. This is very important. When you first enroll in Medicare, there are two main options: Original Medicare and Medicare Advantage. Original Medicare has Part A, Part B, Medigap, and Part D. Part A is your hospital insurance and covers things like hospital stays, skilled nursing facility care, and even some home health services. Part B acts like your regular medical insurance and helps with doctor visits, outpatient care, and things like flu shots or screenings to keep you healthy. Part D is a prescription drug plan designed to help you manage the cost of both generic and brand name medications. It's offered by private insurance companies, and on average, there are around 30 standalone Part D plans available, giving you a range of options to find the one that best fits your needs. Medigap, also known as Medicare Supplement Insurance, fills in the gaps by covering what Parts A and B don't, like co-payments, co-insurance, and deductibles. There are a variety of Medigap plans available, each offering different levels of coverage. It's important to remember that Medigap only works with Original Medicare, not Medicare Advantage, and can help make your costs more predictable by reducing your out-of-pocket expenses. Medicare Advantage is also known as Part C or all-in-one plan, is offered by private insurance companies and combines Part A and B, often including additional benefits like vision or prescription drug coverage. One of the appealing features of Medicare Advantage is that you manage everything through one insurer, using just one card instead of separate cards for Part A, B, and C. However, convenience comes with trade-offs. You will need to deal with networks, referrals, and pre-approvals. In addition to that, you won't be able to purchase a Medigap policy. Finally, while premiums might seem affordable, total costs, including co-pays and deductibles, can add up, so it's important to fully understand how Medicare Advantage works before enrolling. Now, let's talk about costs. Part A is generally premium-free if you or your spouse worked for at least 40 quarters and paid into Medicare. But when I say free, I only mean no premiums. There are still other expenses like deductibles, and if you stay in the hospital for more than 60 days, you may be on the hook for part of the daily rate. Part B has a premium based on your income from 2 years ago. For 2025, they will look at your 2023 modified adjusted gross income. The monthly premium is typically deducted from your Social Security check. But if you haven't started receiving Social Security yet, you will get a bill directly from Medicare. You will also pay an annual deductible before Medicare kicks in. Parts A and B only cover 80% of your costs, which is why many people add Medigap to cover the remaining 20%. Medigap plans are sold by private insurance companies and come in 12 standardized options labeled A through N. Each plan offers the same coverage regardless of which company you buy it from, but premiums vary. Most people choose Plan G for its comprehensive coverage, though it comes with higher premiums. As you can see, choosing the right Medigap plan can be challenging. However, focusing on both the cost and the coverage options is usually the best strategy to guide your decision-making process. Medicare Advantage and Part D costs vary by provider and plan. To have your prescription covered, you will need to select a Medicare drug plan available in your area. There will be several options to choose from, each with its own drug list, coverage details, and pricing. Keep in mind, you will likely need to pay deductibles and co-insurance each time you fill a prescription until you reach a certain spending limit, which I will explain in more detail later. Enrolling in Medicare is straightforward, but the timing is crucial. When you turn 65, you have a 7-month window to sign up, starting 3 months before your birthday and ending 3 months after. It's best to enroll in those first 3 months so your coverage starts the month you turn 65. If you're already receiving Social Security, you will be automatically enrolled. If not, you will need to sign up at ssa.gov for Part A and Part B. For Part D or Medicare Advantage, you will enroll through medicare.gov. If you miss the window, you may face penalties, so do not wait. There is also a special enrollment period that allows you to sign up for Medicare outside of the standard initial enrollment period. For instance, if you continue working after turning 65 and are covered by a qualifying employer health plan, you can delay Medicare enrollment without facing penalties. Just remember to sign up by the end of the 7th month after the employer coverage ends to avoid late enrollment fees. Similarly, for Medicare Part D, your enrollment timing depends on whether you have other creditable prescription drug coverage. If you are covered by a retiree plan or another qualifying plan and that coverage ends, you must enroll in Part D within 63 days to avoid a late enrollment penalty. Keep proof of your prior coverage, as Medicare may require it to verify that your previous plan was creditable. Missing this 63-day window can result in a penalty added to your Part D premium. If you miss both initial and special enrollment periods, the general enrollment period gives you another chance to enroll in Medicare Parts A and B. It runs from January 1st through March 31st, with coverage starting 1 month after you sign up. However, enrolling during this time may result in penalties, such as 10% increase in your Part B premium for each year you delayed. While it offers a second opportunity, it's best to enroll during your initial or special periods to avoid extra costs and delays. At the same time, from January 1st through March 31st, the Medicare Advantage Open Enrollment periods allows those already in Medicare Advantage plans to make changes. You can switch to a different Medicare Advantage plan or return to original Medicare, Parts A and B. If you return to original Medicare, you can also join a standalone Medicare Part D plan. This period is only for Medicare Advantage changes and does not apply to those with original Medicare alone. If you're already on Medicare, then from October 15th to December 7th each year, you can make changes to your Medicare coverage. During the open enrollment period, you can switch from original Medicare to a Medicare Advantage plan or vice versa. Change Medicare Advantage plans or join, switch, or cancel your Part D coverage. Even if you're happy with your plan, it's smart to review it since insurance companies change their premiums, deductibles, and coverage each year. Open enrollment is the perfect opportunity to ensure your plan still offers the best coverage and cost for your needs. When comparing plans, especially Part D, don't just focus on premiums. Look at the cost of your medications. Formularies and prices can vary between plans. Many people who are not currently taking medications often skip enrolling in Part D, but I strongly advise against this. Even if you don't need prescriptions now, there is a good chance you will in the future. If you don't have proof of creditable drug coverage, typically from an employer plan or your spouse's employer, you could face a late enrollment penalty. The longer you go without Part D, the higher that penalty will be. Fortunately, many Part D plans have zero premiums, so there is no reason not to enroll and avoid potential penalties down the road. If you are on COBRA, be aware that you can only switch to Medicare during the open enrollment period. Otherwise, you will have to wait until it fully runs out. So make sure to shop for a new plan during the open enrollment period and transition in time. If you already enrolled in Medicare, sometime in November, you will receive your income-related monthly adjusted amount determination notice. If your income has dropped due to retirement, act quickly to appeal and potentially lower your surcharge. Lastly, once you enroll in Medicare Parts A and B, you must stop contributing to a health savings account if you have one. The only way to continue contributing after 65 is by staying on an employer plan with 20 plus employees and delaying Medicare and Social Security enrollment. as signing up for Social Security automatically enrolls you in Medicare Part A. Now, let's talk about the changes coming in 2025. There's both good and bad news. I'll start with the bad news first, and then we'll wrap up everything on a positive note. Due to changes from the Inflation Reduction Act, some Medicare Advantage and Part D plans are being discontinued in certain areas, leaving policyholders without coverage. This has led to premium increases for Part D plans, with some jumping from $5 to $20 a month. This is a hefty price increase. Additionally, the Part D maximum deductible is rising to $590. If you don't act by December 7, 2024, you may be automatically switched to a more expensive plan. It's a good idea to shop for new plans since there are still affordable Part D options with $0 premiums. Also, if you received a letter from your insurance company stating that your Medicare Advantage plan is being discontinued, you have the right to enroll in a guaranteed issue Medicare supplement plan. Be sure to explore this option, as it can offer continued coverage without the need for medical underwriting, ensuring you do not face coverage gaps. Now for the good news. Overall, the average premium for standalone Part D plans is dropping to around $40, down from nearly $42 last year, and Medicare Advantage premiums are staying stable. Starting in 2025, out-of-pocket drug costs will be capped at $2,000 per year, effectively eliminating the donut hole. This is a big win for those with high medication costs and means huge savings for people who previously spent thousands on prescriptions. Though this cap only applies to covered drugs. Additionally, keep in mind that manufacturer coupons or discounts cannot be used if you are utilizing Medicare insurance. In some cases, paying out of pocket and applying a manufacturer coupon may be a cheaper option for medications not covered by Medicare. If you are still working and covered by an employer group plan, you can delay enrolling in Medicare and keep your employer coverage. However, be cautious. With the new $2,000 out-of-pocket cap for prescriptions, some employer plans may no longer qualify as creditable coverage. If your plan isn't considered creditable, you could face late enrollment penalties when you eventually switch to Medicare. To avoid this, confirm with your employer whether your plan meets the creditable coverage criteria. If not, check if your spouse's plan qualifies. If neither does, it's highly recommended to enroll in Medicare to avoid penalties, which can permanently increase your premiums. Lastly, starting in January 2025, Medicare will introduce a new prescription payment plan to help spread out drug costs over the year in monthly installments. Everyone can participate in this plan, regardless of their income level. When you fill a prescription, especially for expensive brand name medications, you will first pay the $590 deductible. Then you will cover a copayment or coinsurance. The good news is that your total out-of-pocket expenses for covered medications will not exceed $2,000 annual cap. Thanks to this new payment plan, you can divide those costs into manageable monthly payments over 12 months, making it easier to budget for your medication costs throughout the year. Medicare Open Enrollment is your chance to review and update your coverage to avoid overpaying or missing out on benefits. Automatically renewing your plan could lead to higher costs and coverage gaps. With changes coming in 2025, like rising Part D deductibles and $2,000 out-of-pocket cap on prescriptions, it's crucial to stay informed and proactive. If you need our help in comparing your options and ensuring you are getting the best coverage for your needs and budget, please feel free to reach out. By doing so, you can avoid unnecessary expenses and make the most out of your Medicare benefits. That's it for today. If you found this video helpful, please give it a thumbs up and subscribe to my channel. And if you'd like to learn more about how we help our clients protect their wealth and leave a lasting legacy, please visit us at www.lestna.com. Thanks for watching.